Are you feeling extreme body aches? Is there extreme tiredness, bone pains, muscle pains, pain behind your eyes, especially behind the eyeballs, or abdominal cramps with nausea, vomiting, headaches, lack of appetite? Or are you having high-grade fever with the classic chills and rigors when the whole body is shaking and initially you are feeling too cold and later on you start feeling warm? Or is there any rash on your body? If so, you may be prey to the dengue virus. I'm Dr. Mariam Ateek, and today we are going to discuss what is the dengue virus, how is it transmitted, where does it live, and how it affects us, what we can do to prevent these mosquito bites, and what is the management. So dengue is transmitted by the bite of a special family of mosquitoes, the Aedes aegypti type, which can be recognized very easily on naked eye by the presence of black and white stripes on their body. The dengue larvae, they survive best and propagate best at temperatures of around 30 degrees centigrade. So lately, due to these irregular monsoon rains, the high temperatures, the heat waves due to climate change and all this flooding, the incidence in the dengue cases has drastically increased. So what do you do? If you have these symptoms which we just discussed, you have to obviously contact the doctor. You have to get tested for the dengue virus, and then accordingly you have to be managed. Now, we do not have actually any cure or any vaccine for this dengue virus, and the symptoms have to be treated. Like for nausea and vomiting, you have to be given those anti-vomiting tablets. For fever, you have to be given the fever control tablets, and likewise. But in the meanwhile, what you can do on your own? You have to stay hydrated. Drink lots of water so that your system remains clean, it works well, and it can gain its immunity and strength to fight the disease. Then you have to sleep well, again, to get all the rest to make your body fight against the disease. Then you have to eat well. It attacks the red blood cells and the white blood cells, especially the platelets. Therefore, you have to take your iron and folate supplements. Now, what causes all these symptoms? This virus enters when the mosquito bites us, and then from the blood it travels to the liver where it starts multiplying, and after 7 to 14 days it is released back into the blood where it starts attacking the blood cells and especially the platelets, which causes these chills and rigors and fever and the rashes on the body. If it is not recognized at that time and proper rest and management is not done, then the platelet level can get very, very low, and platelets are responsible for clotting the blood in our body to keep it controlled within the places where it should be. So our natural orifices, that is the nose, the mouth, the eyes, they can all start bleeding. There can be blood in our urine and there can be blood in our feces. So you have to take care. How? You have to manage the breeding places of these mosquitoes. We know that mosquitoes live in hot and humid areas where there is lots of water stagnation. So first of all, we have to decrease the breeding grounds of these mosquitoes by maintaining cleanliness in and around the house. The garbage has to be disposed of properly. It has to be kept closed. The garbage disposal areas have to be fumigated regularly. Insecticides have to be sprayed in and around the house. Now, this dengue mosquito has a special propensity that it not only grows in the dirty stagnant water, but it can grow in the, these larvae can survive in the clean water also. So the water containers in and around the house, they have to be kept clean. The buckets, the cisterns, the drums, the water tanks, they have all got to be cleaned regularly. They have to be kept covered so that the mosquitoes cannot go and breed in them. Then the indoor plants, they have to be removed either from inside the houses, or their water has to be changed every 2 to 3 days, so that the mosquitoes will not get an environment to breed. Then the drainage system inside the house, outside the house, all has to be kept clean so that there is no stagnation of water. This all needs to be done prior to the beginning of the rainy season. This mosquito breeding time is maximum during the monsoon months, that is from June till August. But from last year, due to all these irregular monsoon rains and flooding, then heat waves caused by climate change and extra heat all the time is increasing these cases to a drastic level. So what else you can do? We should know. Now, we do not eat all the time. We have got timings for our breakfast, lunch and dinner. In the same wise, this mosquito, it likes to feed at dawn and at dusk. So this early morning time and the early evening time around Maghrib, those are the timings when you have to avoid going out. If you go out, then you have to be completely braced for protection from this mosquito bite by applying the mosquito repellents, which usually should contain a chemical called DEET. The good mosquito repellents have that chemical, so apply it on the exposed parts of the body. Keep protective clothes on, that is, your clothes should cover from your hands, from your neck all the way down to your toes. And even have to wear the socks and everything, so that you do not give extra exposed skin available for the mosquitoes to bite. Then you have to put some covering under your doors of the house, and you have to put nettings on your windows so that these mosquitoes cannot come inside. Then during the daytime, when there is sunlight, there should be good ventilation in the houses, and there should be good sunlight because these are natural disinfectants. And when you sleep, please use the mosquito nettings. So take care of all these things and stay safe